So, how are teeth related to our whole body health? I know this sounds crazy, but you actually have probably heard this before. So the eye tooth, your sharp pointy tooth, your canine, is called the eye tooth because in ancient China, they made these associations that when there was a problem with the tooth here, it might explain somebody's knee problem or their hip or their eye. And so we see this clinically as being relatively important. I won't say I live and die by it, but if you have a knee problem, sometimes I wonder if you don't have a problem at your knee tooth. For example, these two, and these are a total of these four, and I think it's these two and these two. So those 8 teeth are associated with breast cancer. I think there was don't quote me on this, but there was a clinic in Europe. They only treated breast cancer. And of the 150 next women that came in, when they looked at those teeth, there was a problem in that tooth, whether it was gum disease, root canals, a low-grade infection that they didn't even know about, or maybe it's something they were living with, a painful tooth. So a bad tooth can make you, in some way we think, disadvantaged in that organ, and that organ can suffer. I've seen people have bladder problems, prostate problems associated with these bottom teeth here. I have seen essentially every problem here. A good friend of mine was having chest pain, tightness, neck and shoulder pain. I kind of kidded with him that it was probably related to a bad tooth. He had seen a physical therapist for 6 weeks, working on his arm and shoulder. An excellent physical therapist, I might add. And it just didn't seem to help. And then he kind of mentioned to me, and actually came to the doctor, if you can imagine that, came to the doctor, and I asked him about teeth because nothing else was really making sense. He'd been to the heart doctor. Everything really checked out. So talked to him about the tooth. He kind of laughed and rolled his eyes. I sent him to a friend of mine, a dentist, and that tooth bothered him. So the heart tooth, one of these. So this one, this one, this one, or this one, I can't remember which one it was. And would you believe, as soon as that tooth was pulled, like an hour later or so, his neck, shoulder, and chest pain went away. I wasn't shocked at that point because I'd seen so many cases like that. He was shocked. He thinks it was crazy. I think it's crazy still, but these associations were made thousands of years ago and put down on paper. So we have those. So it's related to the acupuncture meridians. Teeth have meridians. Apparently, maybe the feet do. I'm not an expert in all that, but I find it pretty crazy, and we've had patients sit here and before I even walk in the door while they're seeing the nurse, and they'll make these associations and go, oh my gosh, is that why I have GI problems because of this bad tooth? And I'm not saying it is, I'm not the dentist, but I am saying there is association. I've clearly seen it, and to me, it is crazy, but that's how we're made, and it's really cool. So, hope this helps, and you can solve some of your problems. By the way, there's a lot of things associated with a tooth, like this one, for example, pancreas, stomach, the ligament of the knees or the jaws, ethmoid sinuses. I rarely see if a person has a problem in that tooth that they'll have all of those. Usually it'll be like 1 or 2. So a lot of times they'll say, yeah, that part of my knee does hurt. And this is specific, not just the knee, but actually the front of the knee or the back of the knee. So another way I'll find out it's a tooth problem is if I inject something and I expect it to get better, like your bad knee or hip or shoulder or whatever, and you get better, but then you get worse again, and it just doesn't want to solve the problem, I'll start thinking tooth. We'll get you to a dentist. They'll evaluate you with what we call a cone beam. First x-rays, maybe a cone beam CT scan. They'll look, and sure enough, they'll find it. I had a patient she was in her 40s recently, and she went to her dentist, really good dentist, by the way, and she said, Dr. McWhorter thinks I may have a tooth problem. And I was saying that because she had developed several places of arthritis. She didn't have any lupus or rheumatoid or any of those kind of bad arthritises, but her arthritis was bad, much more than you might think for her age. So her blood pressure was higher. And I said, it might be a tooth, because when I inject your knees, they get better, but then they go right back to being bad again. She went to the dentist, and she said that he was saying, I don't think it's your tooth. And he went around checking the pocket depths between the gum and the tooth. Well, he got to this one particular tooth. I want to say it was right in here. And he took it's like a toothpick, basically. He put it, and it went way down. And he said, oh my gosh, it is a tooth. So he pulled that, and while she was still in the office, her knee pain, I think her hip pain, both knees, one hip, just started going away. She was telling him, he was kind of freaking out and laughing and excited. And so crazy. I hope this helps, but we really like talking about teeth and getting the body well, because it's not often you can just cure a bad knee with something, 2 or 3 feet away by pulling a tooth.